So why do we need to treat? What do we treat? Why do we treat type 2 diabetes? You actually rarely do not die of elevated sugar. So we tend to focus on sugar because sugar is elevated in diabetes, but high sugar doesn't kill you. Very rarely does it do that. So you can certainly get instances where sugar's in the 800s or 900s and you can go into a coma. So it can happen. But mostly when it's not the sugar that kills you, it's the complications from diabetes that cause disease and ultimately death. And so the reason why we treat diabetes is not to get your sugar low, though that's a part of the treatment, is to prevent these complications of diabetes. And you can break down diabetes complications into two things, what we call microvascular and macrovascular. Microvascular are the small blood vessels in our body that supply various organs. And so the blood vessels in the eye are damaged with type 2 diabetes, and type 2 diabetes is one of the leading causes of blindness. The small vessels supply the nerves, and so you can get what's called a diabetic neuropathy. It can cause pain, and patients with diabetic nerve pain or diabetic neuropathy can suffer greatly. It also causes decreased sensation, and so because diabetics don't heal very well as well, they can injure their foot and don't even realize it. And that diabetes is one of the leading causes of amputation. And finally, the small vessels that supply our kidney, diabetes is one of the leading causes of kidney failure. And so you can lose your kidney function and be on dialysis like in the picture. So those are the microvascular complications. And then macrovascular are bigger blood vessels, and damage to the bigger blood vessels caused from diabetes leads to heart attack or stroke. And those are the biggest risks for death for patients with diabetes is heart attack and stroke. And so while we focus on sugar management, we're really treating diabetes to prevent these complications, to prevent kidney failure, to prevent blindness, to prevent neuropathy, and to prevent heart attack and stroke. And so that's why we treat type 2 diabetes.